Toprol XL is a beta blocker used to treat chest pain, angina, heart failure, and high blood pressure. The active substance, metoprolol. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. This drug works by blocking the action of certain natural chemicals in your body, such as epinephrine, that affect the heart and blood vessels. This lowers heart rate, blood pressure, and strain on the heart. Indications. Toprol XL is a prescription medicine used to treat the symptoms of chest pain, angina, high blood pressure, hypertension, and renal impairment. Toprol XL may be used alone or with other medications. How to use. Take your medicine at about the same time each day, preferably together with the morning meal. Taking it at the same time each day will have the best effect. It will also help you remember when to take it. Hypertension, adults. The usual initial dosage is 25 to 100 mg daily in a single dose. Adjust dosage at weekly or longer intervals until optimum blood pressure reduction is achieved. In general, the maximum effect of any given dosage level will be apparent after 1 week of therapy. Dosages above 400 mg per day have not been studied. Pediatric hypertensive patients is greater than 6 years of age. The recommended starting dose of Toprol XL is 1 mg per kilogram once daily, but the maximum initial dose should not exceed 50 mg once daily. Adjust dosage according to blood pressure response. Doses above 2 mg per kilogram or in excess of 200 mg once daily have not been studied in pediatric patients. Angina pectoris. Individualize the dosages of Toprol XL. The usual initial dosage is 100 mg daily, given as a single dose. Gradually increase the dosage at weekly intervals until optimum clinical response has been obtained, or there is pronounced slowing of the heart rate. Dosages above 400 mg per day have not been studied. If treatment is to be discontinued, reduce the dosage gradually over a period of 1 to 2 weeks. Heart failure. Dosage must be individualized and closely monitored during titration. Prior to initiation of Toprol XL, stabilize the dose of other heart failure drug therapy. The recommended starting dose of Toprol XL is 25 mg once daily for 2-week patients with NYHA class 2 heart failure and 20.5 mg once daily in patients with more severe heart failure. Double the dose every 2 weeks to the highest dosage level tolerated by the patients, or up to 200 mg of Toprol XL. Initial difficulty with titration should not be preclude later attempts to introduce Toprol XL. If patients experience symptomatic bradycardia, reduce the dose of Toprol XL. If transient worsening of heart failure occurs, consider treating with increased doses of diuretics, lowering the dose of Toprol XL, or temporarily discontinuing it. The dose of Toprol XL should not be increased until symptoms of worsening heart failure have not been stabilized. Toprol XL tablets are squared and can be divided. However, do not crush or choose a whole or half tablet. Contraindications. Toprol XL is contraindicated in severe bradycardia, second and third degree heart block, cardiogenic shock, decompensated heart failure, sick sinus syndrome, unless a permanent pacemaker is in place, and in patients who are hypersensitive to any component of this product. Precautions. If you forget to take a dose of Toprol XL, skip the dose you missed and take your next dose when you are meant to. Don't take a double dose to make up for the dose that you missed. If you become pregnant while taking Toprol XL, tell a doctor immediately. Do not stop taking Toprol XL without checking with your doctor. Your doctor may want to gradually reduce the amount of Toprol XL you are taking before stopping completely. This may help reduce the possibility of your condition worsening or other heart complications occurring. Be careful drinking alcohol while you are taking Toprol XL. If you drink alcohol, dizziness or lightheadedness may be worse. Toprol XL side effects. Get emergency medical help if you have signs of an allergic reaction to Toprol XL, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call your doctor at once if you have very slow heartbeat, excessive tiredness or chest pain, a lightheaded feeling like you might pass out, shortness of breath, even with mild exertion, swelling, rapid weight gain, or cold feeling in your hands and feet. Common Toprol XL side effects may include dizziness, tired feeling, depression, confusion, memory problems, nightmares, trouble sleeping, diarrhea or mild itching or rash.